So, what happens when you feel for sure that your hormones are off? Whether you're male, female, you have a sense that something's off. All your other kind of normal labs look okay, but you just know that you're not feeling balanced. So, energy, mood, sleep, libido, sexual function, so ability to maintain an erection, climax, having an orgasm that is as strong as you want it to be, having sensitivity sexually that feels like, it's where you want it to be. When women have vaginal dryness, vaginal irritation, low libido, urinary symptoms, so having urinary frequency, urgency, having cycle irregularities. For men, just feeling like, you just don't really care. You don't really like, one way or the other. You're just going to get up and kind of go through the motions of the day. Not really having that sex drive anymore, not really having that sharpness or that quickness. For a lot of people, they're pretty sure that there are hormonal factors contributing. You go to your provider, if they'll even test them for you, they tell you everything's normal, it's fine, don't worry, but there's something going on. Well, this is an important piece of information for people to understand, that when we look at lab levels in a conventional model, typically providers just want to make sure you fall in the normal range. There are huge ranges for hormones being normal. And just because you're, in the normal range does not mean you're optimal. Also, there are some really important factors that impact even where that hormone falls on the normal range. The other question is how much of that level, how much of that normal level is your body actually getting to use. So there's something that's bioavailable, meaning you have a certain amount circulating in the body that's your total hormone level, but not all of it is available for use. There's something called sex hormone binding globulin. It's a sticky substance. So picture it like, a little sticky sponge floating around the body. And when it floats by hormones, it's attractive to them. So they hop on, go for a ride. It's kind of like the delivery truck of the body. So then the body brings it, that sticky substance goes to the receptors that are built for those hormones, and the hormones hop off that sponge and pop into the receptor. Well, there are factors that have to do with how much of that sponge, how much of that sticky factor is available in the body. So if you have a huge sponge, you're going to have a lot of hormones that are sticking onto it. It means there's less available for the body to use. And if you have a tiny little sponge, it means that there's going to be more hormones floating around available to bind to those receptors. So what determines whether you have a whole lot of sticky sponge or a little tiny bit of sticky sponge or somewhere in between? There's a lot of factors. Some are just genetics. Some of it's dietary and nutrient and supplements. A big population of people have a larger than normal amount of that sticky substance because of things like medications that are pretty common medications that we take, and for some people, multiple medications. So you have a lot of sticky substance, and then less of that total amount of hormones are available to bind to the receptors in your body. So, for example, blood pressure medications, statins for cholesterol, SSRIs, so any kind of anti-depression, anti-anxiety medications can contribute. Birth control pills are notorious for increasing sex hormone binding globulin so that your natural hormones, you don't have as many available for use. Additionally, if people have a history or current use of narcotic pain medications or benzodiazepines, opiates, that actually can change the actual receptor structure. So it means that your body's less likely to make a space for that hormone to bind. So big picture, there are a lot of things that can be affecting what's available to the body. Even if your levels look normal, we have to look at multiple components. So not only what's your total amount of your hormones, but what is your binding globulin? How much sticky factor is there? And for some hormones, we can actually even look at what's free floating in the blood. You might have a normal total, a whole bunch stuck to that sponge, and only a little bit floating around in the bloodstream, meaning that you don't have the amount your body needs. And so your suspicions are probably true that you don't have enough hormones available. You do feel deficient even though you look normal on that lab level. So it's important to work with a provider who understands this, who can look at the bigger picture. I'm happy to help in any way that I can. Reach out and message me, and we can talk about what labs we can look at and how to determine if you're optimal in your hormone levels.